I'm Gayle Guyardo. Welcome to Bloom, presented by Lifeguard Imaging, Tampa Bay's only TV show dedicated to health and lifestyle. Get ready to bloom. It is World Menopause Day, and today on Bloom, we're getting rid of the stigma and talking about a season of life that most women spend suffering in silence. But guess what? There are things that you can do to feel better, clear the brain fog, and control the mental anguish that many times surfaces during this phase of life. And trending today, top medical experts believe workplaces should normalize menopause just like we do pregnancy. 3 out of 5 working women between the ages of 45 and 55 who are experiencing menopause symptoms say it has a negative impact on them at work. And 30% said symptoms got so bad they had to take sick days. But our next guest says there are ways to manage those symptoms and get relief. Joining us now is functional wellness expert Dr. Cathleen Gerenger. Dr. Cathleen, it's always so great to see you.
It's great to see you again, Gayle.
And while we are talking about World Menopause Day, ladies, this is not just for those of us in our golden years. This is for everyone because you can really start tackling some of these problems before they even happen.
Absolutely, especially women in their 20s and 30s. If we're able to be proactive with their health care, especially when we support the hormonal system, then they can ease their way up into perimenopause and menopause.
Yeah, and you and I were talking earlier. I mean, look at J-Lo. I mean, you know she's in that peri or postmenopausal stage, and she looks like $1,000,000. And if you start doing the right things in life and getting the right treatment protocols, you know, you can have that kind of life. You don't have to hang up your hat in your 50s, correct?
Absolutely. When we hear the word menopause, everybody thinks it has to be like the Golden Girls, you know, joint aches and pain, and can't even move, or always sick. And we don't have to approach menopause that way if we're proactive with it and support the underlying problem.
And you start with your patients with a very deep dive into blood work. And this panel is not what your regular physician might order. You like to look at everything and get a really big scope of what's going on.
Absolutely, because our body, it functions as a whole entire unit. You cannot just isolate testosterone or cholesterol or even progesterone on its own. It works together to allow our body to support the hormonal system.
So a cholesterol issue could parlay into a hormonal issue?
Absolutely, because our liver makes cholesterol, and cholesterol is needed for the pathway of all these hormones. What we find out is that when we support these underlying deficiencies, suddenly their cholesterol level goes down.
That's incredible. So talk to me about hormone therapy. Is that the first line of defense for women in dealing with menopause and perimenopausal symptoms?
Absolutely. What we want to do is that we order comprehensive blood work. We want to look at the thyroid. We want to look at the progesterone, the testosterone. And if they have sleep issues, I check their prenatalone, which is the mother of all hormones. If prenatalone, mother of all hormones, is low, it's not going to be able to go down that pathway.
So, and you can start this at a young age, because a lot of times, you mentioned thyroid issues. I bet you there are a lot of young women walking around out there not realizing that they might have a sluggish thyroid, or they might have hormonal imbalances that could even lead to infertility issues down the road.
Absolutely, depending on your age group. If you're in your 20s or 30s, what I try to do is I screen for the thyroid. The thyroid hormone is the first hormone to go when you're about 20, 25. The next hormone to go is your progesterone, then the testosterone, and then the estrogen.
So estrogen therapy, is that part of how you treat your patients?
It really depends on their history, too. Their medical history is really important. When we hear estrogen, we only think about the bad estrogen. There's 50 different types of estrogen in our body. So the estrogen that a lot of bioidentical hormone doctors do is that they focus on what we call estradiol. And estradiol is the good form of estrogen.
And I've been reading on some of the treatment options. What about vaginal estrogen? Do you stand behind that? What's that? What even is that?
Exactly. Well, it really depends, again, on that individual. Vaginal estrogen, what they do is that they actually put it topically so it's able to absorb. There's something called pellet therapy, where you're able to do a subcutaneous insertion around the buttocks area it's being released about 6 months at a time.
And you can approach this as your comfort level is as a woman. So there's treatment options that might be oral medications that you rub on, like testosterone, onto your body. So there are different modalities of the treatment, correct?
Absolutely. But baseline blood work is key. And again, creating that check and balance system, do post-labs to see how your body is able to assimilate those hormones.
So you shouldn't be blindly doing a treatment. You should start your treatment, what, 3 to 6 months later, get your blood work? How do you work it?
Yes, depending on the delivery system. With pellet therapy, you're able to see it within 4 to 6 weeks. With anything like cream or topical, it might take a little bit longer. I would wait about 2 to 3 months before I recheck the labs.
And then you can start fine-tuning. And once you go through this treatment, what are the changes that women start to see?
Biggest changes that women are like so surprised is their cholesterol suddenly goes down. And they're like, oh my gosh, my doctor, my cardiovascular doctor said that I need to be on cholesterol meds. Again, I'm not against medication, but if we support the underlying deficiency, your body has the ability to heal itself.
You know, that's so interesting because I eat right, I exercise, but I started having cholesterol issues that were popping up, and they talked to me at my regular physician's office about right away starting those medications. And that Band-Aid approach to treating an issue might not get to the root cause of the problem.
Absolutely. So when we look at total cholesterol, we look at the good cholesterol, HDL, and the bad cholesterol, LDL, but also look at their triglycerides and their insulin fasting, so you know that if their dietary habits are good or not. I always say your blood don't lie. I know.
Yeah, so a patient might tell you something, but the blood will tell you something totally different, correct?
Absolutely, yes.
And then you can also help women achieve better sleep, better lifestyle, maybe better bone density.
Yes, or even increase the libido. Look at how many women, especially in the working force, most of them are not able to function because they're going through this menopause. And so 1 out of 5 women in the workforce are battling with this menopausal issues, that they can't sleep, they have anxiety, they're depressed, low sex drive.
Yeah, that is one of the big topics of World Menopause Day, is that just like we're normalizing pregnancy in the workplace, we really need to normalize menopause and help women get what they need to get done so they can be firing on all cylinders. Dr. Cathleen, as always, it is such a pleasure to see you.
Thank you so much.
Yeah, we really appreciate you. And I'm going to connect you with Dr. Cathleen on our website.